Hey, Suzanne here with caregiverhaven.com. So here's what nobody talks about with the holiday gatherings. And that family dinner that you've been planning, it could be very dangerous. It could put your aging parent in the hospital. I'm not trying to scare you. I'm trying to prepare you because right now, three dangerous respiratory viruses are peaking at the exact same time. They do this every year. It's flu, COVID, and RSV. They don't take a holiday break, and your vulnerable parent, your senior, is the perfect target. So if you have a senior you're living with, or if you are the senior, I want you to know exactly what's going on. Having worked as a physician assistant in the emergency room and having worked at the urgent care so many years, I have seen this over and over again. Seniors end up in the hospital. Absolutely. But the reason I have Caregiver Haven is to help support you and explain things to you and give you the knowledge that you might not know, the things that we see during the holidays. You shouldn't have to choose between celebration and safety. Absolutely not. So I want to keep you safe and I want to show you what we do to keep ourselves safe. So, what's maybe keeping you up right now? Is it all the family coming and you don't know if mom or dad can take care of themselves while you're planning all the things that have to be done? Do you have a brother that shows up coughing, or you have a sister that thinks COVID is over, or they refuse to get tested, but oh, it's just a slight fever? Maybe your loved one has COPD or some kind of respiratory illness. Maybe they just got over pneumonia. Maybe they had COVID. We just don't know. But when we talk about safety and you want to keep your loved one safe or yourself safe, it seems awkward and your family doesn't get it. They don't understand. Oh, you're fine. You're fine. Don't worry about it. No. If somebody's coughing on you, if somebody's standing over your senior talking to them, they are dripping mucus all over your senior. Okay. They need to be level to them face to face, or even below them would be better. All right. Especially, they shouldn't be near them if they're sick at all. So, do you risk huge celebrations and hope for the best? Or do you cancel them and deal with the guilt and the disappointment? Or do you try to enforce rules that half your family will ignore anyway, right? And only make you out to be the bad guy. Here's the worst part. You're probably doing this all alone, and you're the one that's losing sleep over it, and you're the one who'll be blamed if something goes wrong, and you're the one who will be in the emergency room at 2 a.m. if your parent catches something. I see you and I know this, and it's exhausting, and I'm going to help you figure this out. All right? There are 5 practical steps that actually work in real families with real dynamics, not perfect laboratory conditions. 5 steps. So, tip number 1, start with the guest list, not the menu. Before you plan anything else, figure out who's actually safe to attend. This isn't about being mean, it's about being realistic. If someone's been sick recently, if they're kids, which kids, they're little virus carriers. But if the kids have been exposed to viruses at school, or if they refuse to take basic precautions, they get a separate visit, not the main gathering. You can love somebody and still protect your parent from them. So that's 2 different things, right? So have these conversations now, not the day before the holidays. All right? The emotions are going to run high if they're told at the last minute. All right, the second thing, make testing non-negotiable. Here's the script. Hey, everyone, we're asking everyone to take a test if they have been sick. It's not about trust. It's about keeping mom out of the hospital. So you can keep these COVID tests in your house if you want. A lot of people still have them from a couple of years ago, and they're good for several years anyway. But let's say they're running a fever, and they don't normally run a fever, right? Ask that they be tested. Ask them to go to the urgent care and be tested for the flu or for strep or for RSV, which some clinics can test for, or COVID. Ask them to be tested. Some people will be annoyed But if they're running a fever or they're coughing or they've been exposed to somebody who was recently diagnosed with all of this, then you have a right to ask this to protect your senior. All right? That's okay. If you're a senior or you're protecting a senior, health is not up for debate. It just isn't. And yes, these tests aren't perfect, but you will catch a lot of infections before they spread. It's really good and cheap insurance. Okay, next, let's fix your ventilation. This is number 3. It sounds boring, but it's one of the most powerful tools. Viruses love stuffy indoor air where everybody's breathing the same recycled particles for hours, right? I know it might be cold out. You can crack those windows, even if it's cold. Yes, in December, you can do it. And you run air purifiers if you have them. Don't run those scented things. They don't get rid of viruses and they don't get rid of bacteria. So step up, with even outdoor heaters if you want, so people can rotate outdoors if that's what they need to do. Spread people out instead of packing everyone in one room and shorten the gathering. 3 hours of exposure is way riskier than 90 minutes. So everybody comes in, everybody sits down to eat. They're all eating at the same table. They're all laughing. They're all talking and eating, right? So it's all putting everything out there. The other thing I have to tell you is what I called it: airplanes, cruises, and babies. ABCs: airplanes, babies, and cruises. ABCs. Those are the number 3 top ways people get sick. Absolutely every time. They come off the airplane, they show up in the emergency room or the clinic. They come in from a cruise, notorious for viruses of every kind, respiratory and gastrointestinal viruses. Oh my gosh, sicker than dogs coming off a cruise. And babies, small children, perfect for giving you viruses. So you can have a meaningful time together without the marathon sessions, okay? If your parent is comfortable wearing a high quality mask during the busiest parts, like when everybody's arriving or during the dinner prep, that's excellent protection. Instead of now being exposed for 90 minutes, they take off the mask only for dinner. So they're exposed for 15 minutes, all right, instead of 90. All right, watch for the subtle warning signs. And what do I mean by this subtle? Okay, seniors don't always show obvious symptoms. Seniors are very hard to diagnose. Your parent might not spike a fever or develop a dramatic cough right away. Okay? Instead, watch for confusion, sudden tiredness, loss of appetite, or just seeming off. All right? If your normally sharp mom seems foggy, or your dad who usually helps clean up, just wants to lie down, don't brush it off as tired from the holidays. Make sure you get an appointment to get them in to see the doctor. There are antiviral medications for both flu and COVID that work best in the first few days. You want them, especially if they have COPD, to get into the doctor's office. Don't wait, because when it goes bad, and I've worked in respiration, I've seen enough of it, we can't always pull people back. We can get it when we first see it, when it's in its early stages, especially COVID. But the problem is so many people would wait until they couldn't breathe anymore. And then what do you do? Because the lungs are overloaded. We don't want that. We want to catch it early. Okay. And one of the things I tell people is when you see dad or mom lying down and they're sleeping a lot, that's not okay. They're not sleeping necessarily because they're tired. They're lethargic. It's a totally different ball game now. When they become lethargic, they're confused. They're not able to get up anymore. That's bad. That's hospital time. All right. So you don't want them there. You want to make sure they sleep a little and then they bounce up. They get back up. Every day's got to get a little better, not a little worse. Every day's got to get a little better. That's something you have to look for in your seniors constantly. If they're dragging, if they've just had an infection and they're getting over it, better is the key word. Every day a little better. If they're sleeping more and more and more, no, not okay. It's not tiredness. It is lethargy. They're being lethargic. All right. All right. Next thing is you can give yourself, this is tip number 5, give yourself permission to be the bad guy. This is the hardest one, but it's the most important one. You might have to tell people no. You might have to tell them that no is a complete sentence. You may have to uninvite somebody who won't follow the rules. You might have to cancel plans at the last minute if your parent isn't feeling well, or if someone shows up sick. You cancel the whole thing. Some family members won't understand, and they'll think you're paranoid. But what are you going to do? They'll say you're ruining Christmas. But what are you going to do? Let them think that, because here's what matters. Next year, your parent will still be here. You will have made the holidays together. That's worth every uncomfortable conversation and adjusted plan you have to make. You want your parents healthy. You, as a senior, want to stay healthy. I don't blame you. And this is part of healthy aging. When you get around people who are sick, it's not okay. It is not okay for people to cough on you. All right? It's not okay to have a draft. It's not okay to be cold. It's not okay. That just wears on your immune system. That isn't what it used to be. And I know this is a lot to remember, especially when you're juggling a million things like I told you already. But I do have that free COVID safety checklist. It's for flu, it's for anything. It's just the common sense. It's things that we did in the clinic, in the emergency room constantly. We washed our hands every single second. We didn't breathe on people. We didn't let them breathe on us. So take this mental load off your shoulders. Start doing some of these things and you'll have a wonderful holiday. It may not be the one that you want, it may not be that everybody's happy about it, but you know what? You'll be safe. And that's what really counts. You're not overreacting. Just keep your senior safe. You're being thoughtful, you're being caring, you're a family member who gets it. And I'm really proud of you for that. I love that you're going to take a stand. Take care. I hope this helped you. And if you like it, subscribe to my channel because it helps YouTube then put it out to other people. The more people who like it, the more it goes out to other caregivers and seniors. And then also like the video. And I guess you could share it too. That'd be kind of cool. Thanks. So many people need to understand that they can take a stand too. Take care. We'll talk soon. Bye-bye.